Welcome to Case Closed, a case study series designed to help podiatrists learn from real malpractice claims and strengthen their practice. Each case offers practical insights drawn from actual events, highlighting the clinical decisions, documentation practices, and patient interactions that shape the outcome of a claim. Today's case examines the critical role of documenting patient noncompliance. A 68-year-old male with diabetes lived in California and worked as a general contractor. He had a 10-year history of diabetes and hypertension. At the time of care, he suffered from uncontrolled diabetes along with arteriosclerotic vascular disease. The patient presented to our insured podiatrist for evaluation of pain and discomfort in both feet. He was diabetic with very poor peripheral pulses. The podiatrist instructed him to follow up with his cardiologist about his poor pulses. The patient repeatedly refused. Our insured diagnosed the patient with arthritic metatarsophalangeal joints and corns on the fifth metatarsal and on the medial aspect of the fourth and fifth toes. His corns were debrided on 2 separate occasions. The patient returned with infected fourth and fifth toes, and the infection was debrided. He returned again with continuing and progressing infection. He refused recommended hospital care, as well as referrals to infectious disease and vascular specialists. The patient was placed on antibiotics. Cultures returned positive for cocci and alpha hemolytic streptococci. The patient finally accepted a referral to infectious disease, who assumed care and treatment. The infection led to 2 amputation procedures, sepsis, and death. It was alleged that our insured breached the standard of care by failing to refer the patient to an infectious disease specialist and failing to advise him to present to the emergency department for treatment of his progressing infection. Defense experts were retained. A motion for summary judgment was filed, arguing that the undisputed evidence showed our insured met the standard of care and that no action or inaction caused or contributed to the patient's death. The plaintiff opted to dismiss the case with prejudice rather than respond to the motion. The case was voluntarily dismissed with prejudice by the plaintiff, the deceased patient's wife. The plaintiff chose to dismiss the case rather than respond to the motion. With prejudice means the case is closed and cannot be refiled or brought back to court under any circumstances. This case offers several risk management takeaways. Always document a patient's noncompliance. Document all conversations, including patient education, questions and answers, concerns, and your responses. Include patient statements of noncompliance, your observations, and discussions about the risks. If a patient suffers a bad outcome because of their own actions, it is much easier to defend allegations of malpractice when noncompliance is documented in the medical record. Make sure to note refusal of care. If a patient refuses a recommended plan of treatment, document an informed refusal discussion. It may be necessary to ask the patient to sign a refusal of treatment form. Ensure the patient understands the importance of treatment. Ask what they know and where they got the information. Replace any misinformation with accurate information. Explain medical terms and incorporate diagrams and educational handouts. Identify the reason for noncompliance if possible. Find out if it is intentional or unintentional, and why. Understanding the reason can help you address it. Every case tells a story, and every story holds a lesson that can help protect your practice. Thorough documentation, clear communication, and careful follow-through remain your strongest defense against a malpractice claim. To learn more and download this case, visit our website and start strengthening the safeguards around your practice today.